Grant Shapps joining us. Sadly, I can't be with you this morning because I'm quarantining, having come back from the United States. What's taking you so long, Mr. Shapps?
Well, it's quite a complicated thing to put in place, Kay. Essentially, you've got to match up the medical ability, the science, as it were, with the number of days, with the capacity that is or isn't available. We all know how difficult it's been, despite having the biggest amount of testing available anywhere in Europe, in the UK. We still wanted to make sure we could, make sure tests were available for doctors, nurses, teachers, and many others before turning to people travelling from abroad. And we've done that by turning to the private sector for these tests. And there are more complexities as well. You've got to make sure you know who's taken the test and what the result's been and feed that back into the passenger locator forms. So there's been a lot of things to work out to get us to this point. But I think now what we've got is a system that other countries will indeed follow.
Yeah, I mean, the head of Heathrow Airport, one of the busiest airports in the world, or certainly used to be, said back in July that quarantine was the way forward. What's taking you so long?
Well, we've had quarantine all the time. I guess he must have said testing was the way forward. But the reality was that,
indeed so. Slip of the tongue. Let me, in fact, what I wanted to ask you further was how many jobs it might have cost.
Yeah, well, what I was going to say is we've seen other countries try to put things in place, France and Germany and elsewhere. But actually, for example, they had testing on arrival, but actually later discovered that that wasn't picking up the COVID cases. So you had a situation where a test on the day of arrival was only picking up 7% of cases, and that's obviously no good. It doesn't protect the domestic population who haven't been aware, and everyone's been working so hard to drive down this virus. We didn't want to jeopardise any of that. It's taken some time to get the science and the administration and the technical side of this all together. But what we've got and announcing today is a system that will allow people, as you say, rather than to have to quarantine or self-isolate for 14 days, to do that with a test on day 5, and then as soon as you have a negative result, you'll be able to then leave quarantine or self-isolation, which will be, I think, a boost to the travel industry and obviously enable people to travel more.
Yeah. I'm not sure that you've still clarified why it's taken so long to do.
Well, let me explain in a little bit more detail. In which case, it's a good challenge, Kay.
I've asked you 3 times. I've asked you 3 times, and you've not answered my question. So
well, let me. I didn't want to bore your listeners, but let me explain. In which case,
they're not bored at all. They're always fascinated to hear you. Let me move on if I may.
Let me just explain one of the small technicalities. For example,
we ask people to fill in about restrictions that affect more people. How will you decide which tiers?
You've challenged me that I haven't explained.
How will you decide? Why have you not? I've asked you 3 times. Go on.
OK, well, look, one of the things you'll know about when you travel from abroad is there's a new passenger locator form. One of the things that form needs to do is know where you're staying, and then there's the technicality of needing to update that if you do get a successful negative test, so that, for example, Public Health England and the police don't then come and pursue you for having left your home. So you've got to tie that in with medical evidence about how do we know that day 5 is the right day to go rather than day 1 or day 7 or day 8. And all of those things have taken a lot of time and energy and work to calculate and work out. And I'm afraid the science has taken time, along with the administration, along with the private sector being able to be at capacity to deliver the kind of private testing that will now be enabled. So all of those things have had to come together, and I hope you accept there's quite a lot to do there, which is why it's taken this amount of time.
I wish we had an hour to chat, but we don't. How will you decide which tiers are implemented around England?
Well, we've got new data coming out in the next day or so, which is why the actual specification of which tier goes into which place will take place on Thursday, and it will be on the basis of number of cases, for example, number of cases in the over 60s, where it's much more likely or more possible that it could be fatal, and things like the speed at which coronavirus is rising or falling in a particular area, and a couple of other measures along those lines. So we'll just look at all the data for the country, and then we'll be able to allocate the tiers out to the country as a whole.
Didn't work last time. That's why we had to go into lockdown. Why should it work this time?
Well, it is the case that we want to have these tiers just a little bit tougher than before. It is very important that people follow, obviously, what the tiers say, and that the tiers are capable in themselves of bringing the levels down. So we will be going back to some things that are familiar to people, the old rule of 6, for example, but we'll also be making sure that in some respect these tiers are a little bit tougher, because it's important that having now, we hope as we come out on the 2nd, got the R rate back, we hope, below 1, we wait to see that data, that we're able to continue to hold and drive it down further.
What happens if regional mayors disagree? Is there an appeals procedure?
Well, what we're going to do this time is actually allocate these across the country based on the scientific data. So rather than getting into individual negotiations in different areas, which I'm afraid rather delayed the start of some of the tiering last time, and I'm afraid that in itself was one of the reasons that it led to perhaps not getting on top of it as quickly as possible. Instead, we will have a regionalised but national approach where we just look at the data and say, on the basis of this data, that's why this particular area will go into tier 1, 2 or 3.
So just to be clear, it's Andy Burnham's fault?
I'm not blaming anybody, but I mean, it's clear that in Liverpool, where tier 3 came in quite quickly, we've seen the cases come right down. It's been a real success story. We have seen elsewhere where tiers didn't come in as quickly for various different reasons, that actually it wasn't as successful. And that is a fact, I'm afraid, and we don't want to be in that position again.
Which regions are you thinking of?
Well, as I say, it's important to follow the data. So we will have a look what the latest data says. I think it's published tomorrow. And then Thursday, we'll be able to put the entire country into one of 3 tiers.
Yeah, but you're not answering my question again. Are you saying it was Andy Burnham's fault?
No, I'm not saying it's Andy Burnham's fault, but it is a fact.
As a result, we saw... go on.
Look, I don't want to personalise it like that, is what I'd say, but it is a fact that areas that were slower to go into, particularly those tier 3 levels, did not see at the time the cases reduced. Areas that went in earlier, Liverpool is the obvious example, have seen cases fall, and that's very important in terms of protecting the NHS and protecting lives. I mean, it's simply to state the obvious in many ways.
Some people might say he was trying to stand up for his region. I'm sure he'll try and do that again. Last week...
Well, I think the most important thing if you're standing up for your region is to save people's lives.
Yeah, I think that's probably what he was trying to do. Last week, data showed that supermarkets were the most common place visited getting a positive coronavirus test. Why is retail being opened across all of the tiers, and yet pubs and hospitality will not be?
Well, one of the things we know is that people need to be able to go about their lives, and supermarkets is an obvious example where people need to be able to pick up food and goods to go about their lives. It is, not very enjoyable, but of course possible to go about your life without visiting the pub. And so we have had to make choices, and I'm afraid that's been the case all the way through this. Education is another very obvious example. It is a choice that we want to keep kids in school, that we want to be able to keep universities open, and some things have to come before others in this overall effort. And I think the good news is, as we sit here today, that we are at least in a situation where there's some better news coming over the horizon with the mass testing that we've seen being so successful, and the vaccines. But in the meantime, I'm afraid we are going to have to put up with some continued restrictions, and perhaps as we go through and into next year, and then see the cavalry of vaccines and mass testing coming over the horizon.
Yeah, so the hospitality industry is a sacrificial lamb, and that's all there is to it at this stage. Something.
Well, no, in tiers 1, it will remain open, and in fact, it'll boom there because it will not be a strict 10 o'clock closing as it was before. 10 o'clock will be last orders. People will be able to carry on till 11. So there's a little loosening there. In the second and third tiers, though, it does get progressively tighter, and in the third tiers can only open if they're selling food for takeaway or delivery or drive-through, in fact. But, I mean, you're absolutely right. I mean, they have suffered terribly. We've tried to bring in a lot of support, and not only the £25,000 grants at the beginning of this, but also up to £3,000 a month now to help pay for example, the rates bills, and of course the furlough scheme that's been extended through. But no one is pretending any of this has been easy. It clearly hasn't been, and we're all fed up with it, and we all want to be out of the other side. But as a country, I think we've worked together unbelievably well to try to see the back of this coronavirus, and I think there is an end at least in sight. But for the time being, really important that we carry on following these restrictions when the new tiers come in.
Amen to that. £22 billion for test and tracing, apparently, is what it's going to cost. I was just looking at a report from Warwick University saying that there was a technical error on the 3rd of October. At least 15,841 people who tested positive for COVID had not been contacted by the test and trace system. And their analysis as a result of their algorithm says that that resulted in 125,000 additional infections and more than 1,500 deaths. This is what you need to get right, this pesky test and trace.
Well, I think we've said that we want test and trace to be a lot better, and think that clearly there have been issues with it. Having said that, millions of people have been contacted who otherwise would have been walking around, and of course the test and trace system relies itself on people providing accurate information, contact numbers and those types of things, and where we do have that information, 80% of people are being contacted. So look, you're right, it ain't perfect. We want to make it better. That happens when we all contribute towards the system, do what we're asked to do by NHS test and trace if we're asked to self-isolate, but also provide contact information to NHS test and trace. But I should say, actually, there are now 155 areas where there's local test and trace in place, with another 100 local authorities having applied for that status as well. So a lot of this is now taking place on a local basis, and I think that's a good thing. They tend to know their areas better, and maybe people will also respond better when it's with a local connection.
OK, but how much more money is it going to cost? I mean, it's cost £22 billion. That's more than the Channel Tunnel cost, even if you convert it to what it would cost today's money, and also Crossrail. So how much money do you need to get it right?
Yeah, I think that includes £7 billion sort of going forward as well. That's just been announced. Look, the truth of the matter is that coronavirus has cost this country a huge amount. It's cost the world a huge amount, and we've always said we will have to do whatever it takes to get through and beyond coronavirus. NHS Test and Trace is a very important part of that. Has many different elements, as you know. That the app has now been downloaded 20 million times as the latest figure. That's helping to protect people. NHS Test and Trace, the contact tracing, people following the rules, all of these things come together to try to help. But I mean, to answer your question directly, we have to get through this coronavirus, and I'm afraid there has been no other option but to spend a lot of money, over £200 billion, on all of the support and other things related to supporting the NHS and much more besides. But we're starting to see, with money, for example, invested in vaccine research, that money has been, in many ways, very well spent as regards getting us out of this thing.
Final question before I let you go. You were chair of the Conservatives at a time when bullying amongst activists was said to be rife. It cost you your job. You weren't immediately involved, but you were the chairman, and you took the hit. You must feel a grave sense of injustice that the Home Secretary is still in post.
Well, just to be clear, actually, the bullying you refer to took place 6 months after I was chairman. It wasn't whilst I was there. I just wasn't really happy with the way that it was being dealt with by the party at the time, and decided that I thought it was the decent and proper thing to do, as it had been an appointment that I'd made when I was chairman. But look, I think you're referring to Priti Patel, who's given an unreserved apology if her actions, which, as the report says, there were times where she wasn't being properly supported in her role as well, but nonetheless she's apologised, and I think that was the right thing for her to say and do, and I think that moves the matter on.
So you support her?
I do. I think she's a very good Home Secretary. She's a very determined person in the job, And I note that she wasn't always getting the support that she should have done, and actually wasn't made aware of some of these issues as well. And she's apologised for where her behaviour may have caused problems. So I do think that draws a line, in fact.